I'm diving into the world of food and medication to see if I can uncover which foods might actually mess with your meds. Let's find out together. You've probably never thought about it, but the food you eat can have a huge impact on the medication you take. Whether you're popping pills for a chronic condition or just taking something to get over an illness, what you eat can affect how well those meds work. And, in some cases, it can even be dangerous. It's crazy to think that something as simple as a piece of fruit or a type of protein could change the way your body responds to a medication. But, it's a reality that we need to face head-on. Food-drug interactions are a big deal, and they can be really harmful if we're not careful. So, let's talk about why this matters. When you take a medication, it's designed to do a specific job in your body. But when you add food into the mix, it can change how that medication works. Sometimes, food can make the medication work better, but other times, it can make it work worse. And, in some cases, it can even cause serious side effects. When we talk about the risks of food-drug interactions, we're talking about the potential consequences of not being aware of what we're eating alongside our medications. If we're not careful, we could end up with medication that's not working the way it's supposed to, or worse, we could end up with serious health problems. One of the biggest risks is that certain foods can enhance the effects of a medication, making it too potent. This can lead to things like overdose or toxicity. On the other hand, some foods can diminish the effects of a medication, making it less effective. This can lead to treatment failure or even relapse. But, here's the thing. It's not always a clear-cut issue. Sometimes, the interactions can be subtle, and they can affect different people in different ways. For example, a certain food might enhance the effects of a medication for one person, but diminish it for another. It's a complex issue, and we need to take it seriously. Another risk is that certain foods can affect how the body absorbs medications. For example, if you're taking a medication that's meant to be absorbed slowly, eating a food that speeds up that absorption process can lead to serious problems. And, then there's the issue of timing. When you eat certain foods at the same time as taking your meds, it can affect how well they work. For example, if you take a medication with a meal, the food can affect how the body absorbs the medication. In some cases, the risks of food-drug interactions can be life-threatening. For example, if you're taking a blood thinner and you eat too much vitamin K-rich foods, it can increase your risk of bleeding. So, what are some of the common foods that can interact with medications? Well, grapefruit is a big one. Grapefruit juice can affect how the body absorbs certain medications, making them more potent. Dairy products are another big one. Calcium can affect how the body absorbs certain medications, making them less effective. Leafy greens like spinach and kale are rich in vitamin K, which can affect blood thinners. And, then there are foods that are high in fiber, like beans and legumes. These foods can affect how the body absorbs certain medications, making them less effective. But, here's the thing. It's not just about the foods themselves. It's about the interaction between the foods and the medications. For example, if you're taking a medication that's meant to be absorbed slowly, eating a portion of food that speeds up that process can lead to serious problems. Let's take the example of statins, which are commonly used to lower cholesterol. If you're taking statins and you eat too much grapefruit, it can increase the risk of muscle damage. Or, let's take the example of blood thinners. If you're taking warfarin and you eat too much vitamin K-rich foods, it can increase your risk of bleeding. There's even a case study of a patient who was taking a medication for high blood pressure and was eating a lot of licorice. The licorice interacted with the medication, causing the patient's blood pressure to drop to dangerous levels. But the good news is that, with a little awareness and education, we can avoid these interactions. We can take control of what we eat and make sure we're not putting ourselves at risk. So, what can you do? First, talk to your doctor or pharmacist about potential food-drug interactions. They can give you personalized advice on what to eat and what to avoid. Second, be aware of what you're eating. Keep a food diary or use an app to track your diet. This can help you identify any potential interactions. And, third, do your research. Look up the medications you're taking and see if there are any potential food-drug interactions. You can even talk to a registered dietitian for personalized advice. In the end, it's all about being proactive and taking control of your health. By being aware of potential food-drug interactions, we can make sure we're getting the most out of our medications and staying safe. So, what's your experience been like with food and medication? Have you ever had any issues or concerns? Let me know in the comments below. And, if you want to learn more about health tips and medication management, be sure to check out my other videos. Thanks for watching. If you found this video helpful, please like, subscribe, and click on the bell for more health tips and updates.